Hi, I'm Chris Tricinella. I'm a dentist here in town. I grew up in Tulsa, graduated from Union High School, went to college at Northeastern State University, and went to dental school at the University of Oklahoma, and graduated in 2007 from OU College Dentistry. I grew up knowing I wanted to be a dentist because my father's a dentist, and I watched several of our friends that are in the medical field, and we went and shadowed several of those people. And every time I kept coming back to think, I think the dentistry is the way to go. So watching it for a long time, you see what they do and you realize it's a great profession. I've also wanted to get into dentistry because I found that, it's one of the only professions you can have people leave your office with a completed treatment. They leave with a beautiful smile, they leave happy. You've either taken them out of pain or given them something aesthetically they've always wanted. And so you've made them look how they want to look, and so it's very satisfying. I'm honored to be the president of the Oklahoma Academy of General Dentistry. It's a nice organization that's run by general dentists, and so we get to help regulate how dentists are regulated and how the continuing education that we receive in the state, how it's brought to dentists, and so we can learn and increase our careers moving forward, trying to better the profession. So I'm really big in dental continuing education. That's why I became the president of the Oklahoma Academy of General Dentistry. We strive to look forward to continuing education, and I find that increasing your knowledge and the variety of knowledge helps you treat patients better and helps you treat things that you would have normally not know how to treat, or the whole continuum of treatment. And increasing your education level really helps with that. So what makes us different at South Tulsa Dental is we like to specialize in technology and helping patients. We have a variety of technologies that are different in the dental industry. One of the major ones we have is a machine that makes crowns in the office. So instead of coming back for a second appointment after an impression for a crown, we have a machine that mills it here in the office and we submit it on the same day. One of the other big technologies we have is we have a digital x-ray unit. So instead of looking at a 2x2 square film, we're looking at it on a 21-inch monitor. It helps us see things a lot better, and we can see in a lot greater detail. One of the x-ray machines we have is called a cone beam CT scan. It takes images in 3 dimensions. So we can see all the images in complete 3 dimensions instead of looking at a flat image. It really helps us see things a lot better than what we were seeing before in the traditional film. So one of the things that's really important to us is showing patients and making them understand exactly what's going on before we treat anything. We have iPads that we use, and we show the patients their x-rays on the iPads so they can look and touch and see exactly what we're seeing before we treat anything. The iPads also have educational videos that help them explain what everything is, what a decayed tooth is, what an abscess tooth is, the eruption sequence of teeth and such, so patients fully understand everything they're doing before we treat them. At South Tulsa Dental, we offer same-day emergencies. We like to treat patients on the same day so they don't have to go to sleep with having a bad toothache. So we try to see them the exact same day that they call and try to treat things so they don't have to deal with the tooth pain. So at South Tulsa Dental, we take most major insurance companies. We check, patients call all the time asking us, do we take this variety of insurance and do we take that variety of insurance? We take the majority of dental insurances. The girls in the office are very good at checking that and can give you a good idea of everything before you're seen as a patient. So you know exactly what's coming to you before we treat it. So our office is open Monday through Wednesday. We're here from 8 to 5. On Thursdays we come in at noon and we work until 7 o'clock, so patients can be seen after 5. And on Fridays we work from 8 to noon in the morning. So we're open for Fridays and we can see emergencies before they happen on the weekend. At our office, we try to show all patients exactly what the extent of needed treatment and sequence it in a treatment plan to show you what's the best way to go. And we give you the order of the most important and treat those things first. The treatment plan will tell you exactly what your insurance is going to pay if you have dental insurance and the parts of your copay. And so you'll know exactly the order and the cost of treatment before it happens.